Okay, gotcha. So when you're finding these kids that it's more of a classic brain injury, and you're not really finding a toxic source, they're ready to just rally and heal their brain.
Yeah.
Okay, I get it now. Thank you.
The other options that are there are the urine tests and the stool tests that are easily available to look for patterns there and to look for excretion of metals there. I used to do that for 30 years, almost 30 years, and find them valuable, but I honestly can say that there's nothing I will find in the stool or the hair, the stool or the urine, that I won't be able to predict from the just simple hair test.
Okay.
You know? So I feel, yes, there's more validity scientifically to the stool test and to the urine tests. However, the hair gives me all the guidance I need to get the kids well.
And in the hair test, Dr. Bernard, you're looking for what's not there.
I look for what's not there and the pattern of the good minerals.
Okay.
Yeah, I know if there's a lot of aluminum in the hair,
Yeah.
I know, hey, it's coming out. Great,
Right.
yes, there was the exposure, but yes, the pumps are working. And if I minimize the future exposures from this moment on, remember, this is against the backdrop where treatment strategy number 1 is stop the exposure.
Right.
So if I find a kid that has high level of lead and high levels of aluminum in the hair, yes, I know it came out of the child, but I also know it's coming out. And since I'm watching the further exposures, and I know it's not coming in anymore, I know that eventually we're going to be done with that without really having to do any dramatic treatment.
Okay.
But if I know there was an exposure to mercury from the dental fillings of the mom and the mercury ain't coming out, I try a simple challenge first and then I step it up. Then if the mercury isn't coming out with the cilantro challenge, then I step it up and use the more recognized traditional chelating agents like EDTA, DMSA, DMPS, and so forth.
Now, would you take the same approach with like a TD DMPS? If parents have heard about the TD DMPS and they're kind of excited about it, would you do the same sort of approach with that? Or?
It depends on how much I'm in a rush. Yeah? If I feel the child is already 5 years old and has lost already 5 years where it could have done good detox, I will rush in and do the TD DMPS.
Okay.
But if it's a 18 months old who's just sort of has the first signs of is there something or isn't there, has a little slow development, I start with my cilantro challenge and start easy, gentle, with natural products, using as much of nature as I can, rather than rushing into the biochemistry.
And then if you see a change in the hair and you see it start to come out, you assume you're doing it appropriately, your therapy's working, and you continue.
I continue.
Okay.
You know,
Maybe up the ante, but pretty much keep in place.
Exactly. And the one thing I think is important for the listeners to know, when you have an alcoholic who's making himself toxic every day, with alcohol, the idea is not to take the alcoholic and kind of say, okay, we're going to stop drinking today and we're going to detox you, and from this moment on you stop drinking. What will happen is that the alcoholic will usually die. If you go from full exposure to nothing. It is the same with the internal toxins. If you have like somebody who's been mercury toxic and grew mercury toxic over 9 months, and you want to stop the mercury toxicity with one massive intervention in the beginning, you will kill the child.
Do you think that sort of explains some of these kids that are doing the TD DMPS and they're getting super wacky, stimmy, aggressive, angry, a lot of variables. Some just get better, some get better cognitively but have all this, funky behavior. Is that part of what you'd attribute that to?
There's 2 issues in there. One is the possible redistribution of mercury. You stir it up and it gets displaced from one part of the brain to another one. And therefore triggering a whole new set of behaviors or amplifying adverse behaviors that were there before. And the other issue is withdrawal symptoms. And that has not been mentioned, even though I've been lecturing on this for 20 years. It has not been picked up by any one of the people on the speaking circuit, on on these issues, that there's true withdrawal when you take a poison away from somebody, just like you take it from an alcoholic or cocaine addict away. There's true withdrawal symptoms which look exactly like those types of behaviors. So one has to be cognizant about these different phenomena, and detox has to be done from the beginning, from the outset, gentle and slow, and has to be paced. And you watch the symptoms, and if the symptoms flare up very strongly, you slow down.
So to these parents who are doing the TD-DMPS and seeing these exacerbations of behaviors, you would say one of these two things needs to be addressed. Either you need to, slow down because you're taking away too much of what they've grown used to, or you need to slow down, or rather than slow down, could it be possibly that in that series of jobs that have to be done, when you mobilize mercury, we had a whole list we came up with yesterday of all the things. First you have to donate an electron, then you have to mobilize, transport, break it down, and you bind it for excretion. Could it be that they're mobilizing it, but then not able to transport it?
Exactly.
So you could add things in that can help fill in those holes.
But it's the same with detoxing an alcoholic. When they go through the strong detox reaction, when you withdraw them, you can give them intravenous amino acids and vitamin C, and it will ameliorate that.
Okay.
But given the restrictions and knowledge that we have, and that's available also in a given situation, you always have the option to either slow down the detox or open up the bottleneck of the operation.
Right.
Where is the flow of toxins out, the outflow, where is it restricted?
Oh gosh, I'm so sorry. I'm always so good about telling people to turn their phones off.
So I think in terms of the heavy metal issue, I like to leave it there, to not get too deep into that, all the other things that we could do.
Okay.
I like to go straight to the mold toxin issue.
Okay.
To diagnose the mold toxins. But maybe I should mention one more thing on the heavy metals.
Okay.
The method that I'm using is a simple form of muscle testing, applied kinesiology, that we've sort of evolved over the last 20 years to a system called autonomic response testing, which has very good and clear footing in science and is a very reproducible test. The only test currently that is available to establish in vivo where the metal deposits are in a child and what detox agent would be the most likely one to mobilize them, and also what metal is there, where is it, what quantity. It's the only in vivo test that exists currently anywhere in the world. There's no scientific test. There is functional MRIs which are being groomed now so that they can find metal deposits. At $3,000 a whack, you can find one metal in the brain.
And anesthesia for most of these kids.
Yeah.
Just really quickly on muscle testing, because I know Jimmy was like, what's muscle testing? And I sort of said to him, you can't really just go into a conversation about what muscle testing is unless you sort of have a foundation of easing your way in with energy medicine. But here's what I will say about muscle testing, and of course we'll have more available on muscle testing. All of these really premier, guru, muckety-mucks is what I like to call them, the people who really have sort of this group of people that gravitate around them at all the anti-aging and cancer conferences, don't say out loud that they believe in muscle testing, but behind the scenes, their entire world is based on what they learn through muscle testing or like EAV, energy testing, because it's the only way to really figure out what's going on. Otherwise, you're just stabbing in the dark. And all you guys believe in it. They just don't say it out loud.
The whole idea of the DMPS challenge test, was introduced by me and a small group of other people in the early 1980s, based on our experience with muscle testing. We knew the metals are in there. We were looking for a test that could show them. And at the time, conventional toxicology would take a blood sample. There's no mercury in there. Hey, you're fine. And then we came up, but we found it with the muscle testing, and then we came up with the idea of the challenge test, that we need to first detox the patient and then do the lab test, and then it shows the metals. And so many of the things that are now considered gold standard in conventional medicine have been initially found through muscle testing or electroacupuncture, electrodermal testing. So I think that's all for now we need to say here,
Sure.
Because the people that know what it is, it's basically we're using reflexes in the muscles, the changes in muscle strength and changes in muscle tone to determine what causes stress in the body and what doesn't. And there's various phenomena by which you can find out where metal deposits are in the body and what they are, what metal exactly, what salt of the metal, what concentration, and what detox agent is most likely to get it out. And we can also determine when we're done. So this is probably enough on the metal issue. Quickly through the others. So there's the mold issue. Mold has to be diagnosed in two ways. One, you have to get an air quality guy in the house and check if your house is the source of ongoing mold exposure. Because the molds that are making the kids sick are not necessarily the things that you can smell, taste, and see in the house. And so it will take really a mold culture. You said yesterday, I think, that Home Depot sells culture plates.
I think they have a company where you just buy a little package with a culture plate. They have you put it in the suspect area for like 20 minutes. You put the lid on, you mail it off, and then they send you a report.
I recommend reading that book, Prescriptions for a Healthy Home, from Erica Elliott and Paula Baker. Erica is an environmental medical doctor and Paula Baker is an architect. They reviewed all the literature on these issues and give very nice instructions in the book. It's the best book currently. So molds should be tested outside the body and then they should be tested inside the body. Now the currently best test is done by a lab in California and Los Angeles, Immunosciences. There's 3 mold panels and you should do the one that has at least the Aspergillus, the Penicillium species, and the Stachybotrys in it. So there is a couple of leading molds that are most common in the creation of human illness. And I do feel it's an important test if you get stuck in the progress. This is a test because it's more expensive, it's at several $100s. This test should be done later in the treatment if things don't move forward. The more important test is a test in the home, because once you stop the ongoing exposure, the mold issues are to a large degree self-healing. If it's been created by an exposure, if you stop the exposure and the genetic system isn't damaged, the detox pumps, and the immune system isn't too much damaged, it will recover and then take and handle the molds. But if they continue, the exposure continues like it has been in so many kids that I've seen here, you have no chance of getting the kid well. So the culture plates or spending the $300 or $400 on getting a good company to come in the home and check everything, I feel is a very, very essential part of the treatment.